Clinical features of TGA. Time of presentation depends whether the ventricular septum is intact or VSD is present. Patients of TGA with intact septum are cyanotic at birth with congestive heart failure occurring in the first week because adequate mixing does not occur. Patients with TGA with VSD presents with mild cyanosis and CHF occurs in 6 to 8 weeks. So like if they have an intact septum, they're gonna like develop cyanosis and CHF in the first week. If there is a aorta, there is a VSD, they're gonna develop cyanosis and CHF, but like milder occurs at 6 to 8 weeks. So the inference is the time of presentation depends upon the size or more the presence of a VSD. Important signs include cyanosis and congestive heart failure, ejection systolic murmur single S2, normal S1. X-rays there is cardiomegaly, plethoric lung fields. Echo on side appearance, right upper fields appear more plethoric than other areas. Absent thymic shadow. Okay. Oh my god. So cardiomegaly, absent thymic shadow, plethoric lung fields, egg on side appearance. So அப்படியே முட்டை மாதிரி இருக்கும். Just remember tag and mutta. Tag is like the Pavam young boy. So like Thiago tag. So tag needs an egg. That's how I remember it. Okay. Management of TGA. When TGA is suspected, an infusion of prostaglandin E1, mesoprot or rioprostil. It has to be initiated to maintain the pathway of the ductus arteriosus to allow the mixing of the blood. Whenever we are suspecting the TGA, the survival completely depends upon the patency of the aorta. So we're gonna like put the PG there to keep the aorta open. PG is supposed to open, right? So like we put PGE1, prostaglandin E1, because like E na ilikiranga. So prostaglandin E1, mesoprot, and rioprostil. Infants who remain severely hypoxic or acidotic despite PGE infusion should undergo atrial septostomy, that is artificial ASD to allow mixing of the blood. But however, like atrial septostomy is successful only up to the age of 6 to 12 weeks. Okay. ஸோ ஃபஸ்ட்டு நம்ம என்ன பண்ணோம்னா ப்ராஸ்டாக்லாண்டின் ஈவன் கொடுக்குறோம். ஓகே இன்ஃப்யூஷன் கொடுக்குறோம், ஐவி இன்ஃப்யூஷன். அது வந்து சரி ஆகல. ஈவன் டிஸ்பைட் த ஃபேக்ட் தட் வி ஆர் கிவிங் PGE1 infusion, there is hypoxia, there is acidosis, they have to undergo atrial septostomy, right? Artificial ASD is done, okay, but like 6 to 12 weeks தான். A arterial switch procedure is the definitive surgical procedure. In this, the aorta and the pulmonary artery are divided and reanastomosed in the correct positions. So like the aorta is supposed to be in the left ventricle, right? Other anastomose பண்ணிடுவோம். Pulmonary artery is supposed to be attached to the right ventricle. அதையும் reanastomose பண்ணிடுவோம். Jandine arterial switch procedure is surgical treatment of choice. Mustard and sending procedure. Jandine arterial switch procedure, mustard and sending procedure. Okay, so this is about the TAG, the TGA, transposition of the great arteries. It's the most common conotruncal defect. We know it's transposition, aorta to the right ventricle, pulmonary artery to the left ventricle, two types, complete and corrected varieties. Hemodynamics, the systemic circulation enters into the systemic circulation, pulmonary circulation enters into the pulmonary circulation. The systemic PaO2 O2 SARS will always be lesser, the pulmonary O2 SARS will always be higher, the pulmonary artery O2 SARS. And the survival totally depends upon the presence of VSD. Symptoms will be cyanosis and congestive heart failure. S1 is normal, but S2 is single. And there's an ejection systolic murmur. The weird name is egg on side appearance because tag is Thiago. So like tag is very malnourished small kid who's like, yeah, so like I know this guy called Tag. He's like, he was 5 years old. I don't know how old he is now. So he needs eggs. That's how I remember Tag, and like egg on side appearance because like he's very malnourished and egg is a very good source of protein. Okay, so the treatment is Jandine arterial switch procedure, which is the most important. Jandine, just like Pantene shampoo. Jandine arterial switch procedure is the treatment of choice. Thank you.